Welcome, everyone, to this session of ISCRR's Learning Series. My name is Dr. Kim Pham, Acting Co-Director of ISCRR. Welcome all. Firstly, I'd like to pay my respects to the traditional owners of this land and acknowledge the people of the Kulin Nations. And I'd like to pay our respects to their elders, past, present, and emerging. We'd also like to acknowledge that ISCRR's offices are located on the unceded lands of the people of the Kulin Nations, and we are also co-located with WorkSafe Victoria on the lands of the Wadawurrung people. And so we extend our respects to those First Nations people here today. ISCRR is a unique partnership between Monash University and WorkSafe Victoria. And over the past 14 years, we have had the pleasure of working with world-leading researchers around the globe in the field of workplace health and safety. We are proud to be hosting today's session, What Drives Impact in Workplace Health and Safety Research? And it's going to be presented today by Dr. Jimmy Twin, ISCRR's Research Communications and Translation Manager. A little bit about Jimmy. Jimmy oversees ISCRR's development of a variety of high quality and tailored research translation products that enhances our partners' capacity to use evidence to inform their decision-making to reach research impact goals. Jimmy works closely with the ISCRR's research partners to ensure both our research findings and our insights are delivered in an accessible, relevant, and engaging way. A couple of housekeeping rules for today. The session will be recorded and all of you will receive a link of the recording in the near future. And there's also an opportunity to post questions in the chat as we go. And at the end, we'll have a Q&A session at the end. I'll now hand over to Jimmy.
Thanks for that, Kim. And welcome everyone to February's ISCRRR Learning Series, so the first learning series that we're hosting this year. And it feels a bit odd to be on the other side, being the speaker for today. I'm going to be talking about what drives impact in workplace health and safety research. And before I begin, I also like to extend my respect to elders past and present on the many lands that you are today. And feel free to post in the chat who the traditional owners of the lands are and which you're dialing in from today. So before we get started in this webinar, I'm just going to be launching a poll for you all that for you to answer a simple question. Do you use research to inform your decision-making? And what we'll do, we'll visit this data towards the end of this presentation. I'm seeing quite a few come through, which is great. So at the beginning of all my talks about research impact, I like to put this definition up by the NHMRC about what is research impact. I understand that many of you are from government and industry backgrounds, and from different areas, people have different definitions of what impact is. When we talk about research impact, we talk about the verifiable and measurable outcomes that the research makes to knowledge, health, and society at large. And it's important for that distinction, and it's not the prospective or anticipated effects of research. For example, if we're carrying out research looking at the clinical effectiveness of a particular technique, and we're anticipating that those results will change how an organization treats an injured worker, that's a prospective or anticipated effect. We need to have the actual measures in place and monitored to determine whether that impact has occurred. In today's session, we'll go through the factors involved in research impact success, potential barriers to research impact, and also the importance of decision making. And hence why I put that poll up before, and I'll end the poll just for you to see some of the results up here. And it's very reassuring to see that overwhelmingly 90% of you who managed to put a response in say that you do use research to inform your decision making. And I'm hoping the people who said no or they're not sure, that it's something that upon reflection you'll find out that you do indeed use decision making in your work environment. Now, as Kim mentioned in her introduction, that ISCRR is a joint partnership between WorkSafe Victoria and Monash University. And on April this year will be 15 years of evidence informing decision-making with evidence-based research. In collaboration with WorkSafe, ISCRR adopted a research impact monitoring and measurement framework, which we now proactively use to measure and monitor impacts arising from our projects. This journey really started when ISCRR was founded in 2009. And while during the first 5 years of ISCRR's existence was focused on developing, co-developing and delivering research outputs for partners, including WorkSafe Victoria, there was also several ROI type analyses that were carried out to show the value of that research investment. Over time, there were several other impact assessments that occurred, and it came in about 2018, there was identified that there was a need to put a more refined framework to how we measure and monitor research impacts. And so there's starting to develop this research impact framework that I'll be talking about a bit today. We carried out several research impact pilots to see what the best approach is. And of course, because of certain events that was happening in 2020, we had to refine our methodology based on the pandemic and how that changed our work environment, and indeed how we changed the way that we communicate with our research partners. For the past few years, we have been ongoing implementing this research impact measurement and monitoring. And when it comes to today, I'll be talking to you primarily about findings that came from a conference presentation that I gave late last year at the World Congress on Safety and Health at Work that was in Sydney. I presented a digital poster at this session, and it was examining what's dubbed as silent research impacts arising from government decision-making. And this poster, even though the data it will be presented as part of this talk, will be available also for registrants. As part of this analysis that's going to form the bulk of this webinar session, it was an analysis of 35 different ISCRR projects that were completed between 2019 and 2022. It's important to note that not all ISCRR projects were included in this analysis. So projects that, in particular, that were not carried out by an ISCRR researcher were not included in this analysis, but we are undertaking analysis of those projects at present. These projects include those that ISCRR may have brokered, managed, or helped facilitate, but the research group involved was that external to our research core group. Also wasn't included development of program logics, student projects, and also projects less than a week in duration, in which there was one that fell into that category. Our projects at ISCRR fall into two main areas in our portfolio, those in prevention and those in recovery. And the research methodologies are either through an environmental scan, which is a methodology to look at what the current trends are and best practice is on a certain topic, evidence reviews, evaluations, and those that involve mixed methodologies. So how do we measure impact that comes from these projects? Using a proactive approach, we endeavour to set up, measure and monitor research impact monitoring throughout the research project lifecycle. So from the project development all through to project completion and post-project assessment and review. At each of these points during the project, we take the opportunity to identify intended impacts which can develop during the course of a project, the appropriate method and timing of measurement, and also the key stakeholders to collect that future impact data when it occurs. We largely categorize our impact based on 3 categories, which will be the focus of today's presentation, but also acknowledging that building an evidence base and research capacity underpins each of these 3 categories. And even though it's not being mentioned as a focus today, it is very much an important aspect of research impact. It's integral in the research environment for impacts to occur. And where we can, we develop then impact stories, which are shortened versions of a more formal case study to then examine and showcase our research impact success stories. So I'll be focusing today mainly on these 3 categories of research dissemination diffusion, informing decision-making, and contributing to societal change, and examining what factors are involved in research impact success. So there's a lot of jargon and terminology thrown around in science, and in research impact realm, that is no exception. Research dissemination and diffusion, quite simply, if we put it in simple terms, it's who reads and potentially uses the research findings. So it's who we at ISCRR present research findings to, and then also who the research users themselves then use, interpret, and disseminate to, and so forth. And our external audience list is quite extensive and could be from anywhere from government to injured workers themselves and key peak bodies and organizations. In general, what ISCRR produces as research outputs are reports, presentations. We have now implemented as business as usual single-page infographic summaries, and where we can, academic papers, which include peer-reviewed journals and conferences. And it comes as no surprise to us at ISCRR that all of our research findings from this analysis of these 35 projects were found to have dissemination and diffusion pathways, which is to be expected, given that we're a translational research institute and all of our research is requested by Sinners analysis is requested by WorkSafe Victoria, and so it's expected as part of that agreement that all research is disseminated to appropriate stakeholders. I will note at this point that the extent of this dissemination and diffusion was largely based on how involved ISCRR was with the project and also the availability of data. So where there were champions identified in the business at WorkSafe or with industry, we're able to attain much more detailed and higher quality of data. And at the moment, we're conducting further analysis to examine the depth of these dissemination and diffusion. And what we wish to develop in the future are more detailed dissemination pathways to show where our research tracks and what they may be doing with these findings. The next tier is informing decision-making. So what do they do with the research findings? We're hoping that all our research informs thinking at some level. It may inform next steps in terms of what the requester of the research intends to do, what the research problem is, could inform policy and practice. And as I mentioned, all of our research is translational research. So our goal for this is really in long term 100% that all of our projects should be informing decision-making by the design and request of why that is. But of course, there are some exceptions that come through, which I will be talking about a bit today. Our analysis found that we had measurable impacts for 77% of these projects, which is not 100%. although it's in fine print at the bottom of this slide, there were 8 projects that we weren't able to obtain measures to decisively say whether decision-making occurred. Some of them, the research end users stated that it was simply too early in the impact journey. And we have found for several of these, since we completed this analysis, that they have measurable impacts in place. Or there were difficulties in obtaining the impact metrics themselves. So the impact may have occurred, in likelihood have occurred at some level, but we weren't able to attain that measures. And I'll be talking about these barriers towards the end of this webinar. Looking into what types of decision-making was formed based on these projects, we found that about just over half of them informed current or future strategies. And these were very much related to the research problem and the aim of that research project. Many of these impacts, or what these processes and strategies may be, tended to be internal within the organization or confidential. Just over a quarter of our projects informed treatment guidelines, which is great to see. But they mostly supported current treatment options for injured workers. 14% of these decision-making projects informed program implementation, and these were all evaluations, and some of them were pilot programs or included confidential information. And finally, one of the projects identified informed an internal working group activity, and the nature of that activity was deemed to be quite sensitive at a company level, and so it was regarded as being confidential. The reason why I'm mentioning these caveats is that the majority of these impacts we saw at this level are primarily silent. And what I mean by silence is that you would not readily see these in a public space, these measures to be able to obtain. So normally they'll be quite difficult to measure and monitor without a close relationship with research users, and also without a proactive approach. So for many of these impacts, we feel that if it was done in a retrospective manner, we wouldn't be able to pick up many of these impacts because it really relied on key research users, and it could be individual or team, to be present and able to report these impacts when they're occurring. Now, the highest level of impact is those that contribute to societal change. And it might be easy to misinterpret this level. When I talk about societal change, it can be improving the entire community and society at large, but it also could be improving the outcomes for the individual injured worker. So it could be measured and verifiable evidence of prevention of injury and illness, return to work, an improved journey, which could include improved mental health, improved function, improved quality of life. It also could be improved outcome for the compensation system itself in terms of financial benefit, or improved time and turnaround in claims, for instance. As expected, these types of impacts are incredibly difficult to measure and monitor, and they're often viewed as the endpoint and ultimate goal of research. You can imagine if you start thinking about some of the injuries or illnesses that affect injured workers, it may take many years, sometimes decades, for these impacts to occur and to be able to be measured and monitored. And because of that time frame and that difficulty to measure and competing interests, it can be incredibly difficult to demonstrate a clear link between the research and the impact. This all being said, it was quite surprising, given the short time frame, that 2 ISCRR projects were identified that had a connection to preliminary societal level impacts. Both of these projects were pilot program evaluations, where the ISCRR researchers were actively involved throughout the evaluation timeline, in implementation discussions, providing evidence-based for decision making. And they were seen as improving the pilots during their duration, and there were clear, tangible links to ISCRR's involvement to the improved outcome of injured workers in this pilot receiving compensation entitlements. This was a pleasant surprise and great to hear, both for the injured workers and for the connection with ISCRR research. And because both of these projects have underwent changes based on the evaluation and have now been rolled out to larger targets, they have the potential to impact a larger population. But I would say that these are the exceptions to the rule. We didn't anticipate to see societal level impacts occurring so quickly. We were more looking to see whether there's that opportunity to set up the measures to be able to measure these impacts when they occur. This is a rather busy table, I apologize, that I put up on the screen, but this is just to summarize the impact findings that I just presented based on portfolio level. What you can see is that there's, for most of these categories, in terms of categories within our prevention portfolios, there isn't a real much of a difference based on the low numbers between the different groups. But what we can see is that in the prevention portfolio, that those projects that were identifying and measuring risks and those who are preventing workplace work injury and illness were more likely to have been already at the informing decision stage, as opposed to those more in the promotion space. They take a bit longer. Also, we found that those in the prevention portfolio were more likely to have already informed decision-making, as opposed to those in the recovery portfolio, which is looking at ways of doing treatment, which did quite well, but then claims management and return to work. And it may take much longer to see impacts or decisions occurring. The exception being, of course, those two I just mentioned in that claims management space. So looking now at research impact success factors and what really drove these impacts to occur. And these are impacts at all three levels. So what we have found and recorded to help the measures being determined both at the dissemination diffusion level, informing decision-making and societal change. And I've roughly categorized these into 6 different areas. The first being prospective impact measurement. So it's integral to have discussion with research end users on their research impact goals and how that intends to be measured. This also brings about opportunities for us at ISCRR that we can then look at what we can develop in the translation space to act as an impact catalyst. It should go without saying, but it's incredibly important to have feasible impact goals and to determine whether the goal is indeed measurable, where the research will be used next, and if there's a direct link between the research and the anticipated impact goal. It's also important to consider, even though it might be difficult before the project starts, to think about any potential hurdles that may be in place that may influence whether that impact can occur, and at least to be aware of these to note if there might be a significant hurdle ahead for that impact to be measured or to occur at all. What we have found, and particularly with our evaluations, is that researching engagement throughout the project lifecycle really aided in that starting and continuing the impact discussion. It also ensured that research was tailored to the researcher and user needs and goals, and also for their impact goals. And it goes without saying that having continual engagement helps build a good communication dialogue with champions who are able to drive that change. These champions themselves, they trust the quality of the research data that they're using, and they understand the need to measure and monitor impact data. And then they advocate those research findings and learnings to decision makers and help in that dissemination pathway to continue, and also aid in the decision making. And they may be the decision makers themselves. For all key impact partners, there needs to be resource commitment to address the research problem. And when I talk about research commitment, this will be 3 different areas: financial commitment, time allowance, and capacity to complete the activities. And this also is applicable to the impact measurement monitoring itself. For instance, if there is no capacity or no plans to collect a measure on an injured worker that relates to that project, that we won't collect that data of that societal level change ever. So there needs to be that early discussion and resource commitment to be able to collect those measures. And as our research is translational and connected with industry, we have found that engagement with industry leaders and other key stakeholders, other than industry leaders as well, of course, that they were crucial for help driving a research impact agenda, and also improves the quality of impact data. So rather than hearing through other people what decisions were made or what actions were taken, there's much better quality of data if you get it from the source itself. And also helps aid developing dissemination diffusion pathways, because the more we get to talk with people along that chain, the more we'll be able to find out who's received the finding and how what they intend to do with it. But also they're more likely to then disseminate the research findings further, which at early stages we have found has been very beneficial for many of the projects in this analysis. So next, look at what causes impact to fail. And I put a bit of an alarming headline on this slide, because what causes impact to be failing may be failure to collect the impact measures. And it's important to note that impacts may or will occur without being recorded. In terms of why we're not able to obtain these measures, you can look at this 3 different levels. So from the research provider, such as ISCRR ourselves, there may be communication issues, which may be communication issues in the delivery of the research, how the research is interpreted. It may be pitched at the wrong target audience, or there may be issues in being able to obtain the impact data itself. There may be a lower quality of research, so this will be linked to communication. There may have been projects, and particularly projects when we were starting our pilot work, that we found that may have not hit the mark in terms of what we're meant to provide for our provider, and therefore the impacts were less likely to occur. And also inadequate dissemination. So if people don't receive the findings in the right format that they're able to understand, interpret, and more importantly, readily use, that will then halt that impact journey. For the research user, we found that staff turnover happens in any organization, and the ones we work with are no exception. And it could be difficult to obtain the measures because those people just simply aren't there anymore. Or there may be a lack of engagement for various reasons not to be able to obtain that data. This data that I presented today was primarily involved with WorkSafe Victoria, though we've had several other research partners, and all of them over the years do have changing priorities. There may be changes in government, there may be changes in strategy, there may be changes in what the financial delegation will be, or something like COVID hits, and that might change priorities altogether in certain areas, and that will affect the impact journey. There may be inability to obtain data, as I just mentioned, and also if there's inadequate dissemination from the research user end, it may not lead to those who are doing those pivotal decision-making impacts. And we can't forget external influences. And one thing that is important to note with all this impact work, we have to be quite humble and take what our contribution is with a grain of salt, because there's always external influences and multiple players involved in any impact that occurs. And that can also be a barrier, and it could be the political direction, there could be societal pressure to use a certain avenue or not, and there may be conflicting research findings. And even if some of these findings may be in a different context or setting, which was the reason why they had different findings, there may be varied research quality, or there could be potential biases involved, that there still are research findings that have the potential to have impact and also compete with impacts occurring. And I spoke about in our discussion of decision-making about silent impacts. Why is it important to measure and monitor these types of impacts? So impacts that may be for internal processes to help inform the development of new programs, or to reaffirm that the current treatment is the best treatment. These impacts are not publicized or published in the public sphere. And so, as I mentioned before, can be incredibly to measure and easy to miss. Why it's important to measure these is that for measuring research communication success, that otherwise we will not know how that dissemination pathway, how we translated the findings was effective. And it's our best way of determining whether that research communication hit the right target audience at that right level in the right methodology and format for them to be able to use that for their internal decision-making. It also helps guide future translation activities. We can have learnings throughout this process about what works in certain instances, and that can help us proactively develop translation activities for future projects based on this evidence. And finally, and perhaps most importantly, it demonstrates the value of our research investment. I have not mentioned much during this presentation about return on investment analyses, which simply isn't feasible for ISCRR to do at present for all of our projects, although we have carried out many of these in the past. What research impact measuring and monitoring does, we're able to then demonstrate the value of research investment to our research partners, and also for us to have a continual improvement process in place to continually look at and reflect upon how we can best deliver our research to achieve what we ultimately want to be, to improve the lives of a healthy working population. So, in short, what drives impact in workplace health and safety? Well, what drives it are the factors that are involved in impact success. So taking a prospective approach, feasible goals, research engagement, and identification of champions. There needs to be a resource commitment and engagement with the key research end users is imperative. Also, what drives impact is the awareness of those potential barriers, and to avoid poor engagement communication, to, where possible, improve dissemination pathways, to acknowledge there may be competing interests in decision-making, and also that ability to measure societal impacts is crucial. And also what drives impact in workplace health and safety, simply put, is the need for evidence-informed decision-making. And I'm glad 90% of you in the audience today have already adopted this as hopefully a mantra. And at ISCRR, it is our research impact focus. We have found from this analysis that we have informed current and future strategies, we've informed treatment guidelines, we've informed the implementation of programs and initiatives, we've also informed internal working group activities. And we hope that as time goes on, we're able to see more of these societal level changes coming through. But all of these would be driven by that need for evidence-informed decision-making, and without that, our research would not have the success that we have seen today. And now I will finish and move over to questions. Thank you.
Thanks very much, Jimmy, for sharing ISCRR's research impact journey and for sharing your knowledge on research impact. We will now move to Q&A session. And if you have a question for Jimmy, please post it in either the Q&A section or in the chat, and then we'll endeavour to answer every single one. Just to reiterate, the recording will be shared in the near future, and if you have any requests for further information, such as slides, then please do reach out to ISCRR at info@iscrr.com.au. I'll just open the chat function and Q&A. Okay, Jimmy, you mentioned some of the complexities of measuring research, that connection between research and impact and those silent impacts. And you mentioned a couple of hurdles, but what would you think is the biggest hurdle in measuring impact, and why?
The biggest hurdle comes down to communication. And so without effective communication, none of these processes are possible. It underpins each of the barriers that I spoke about. In particular, to identify champions. And if there isn't that identification of champions who are willing to raise that research banner and say that, yes, this is great evidence that will inform decision-making, that will lead to this change, will address this research problem, then that stalls. And so I think all the barriers really are pivotal around that point.
Wonderful. And that probably links back to the next question, which comes from our Q&A. And so you talked about communication. And is there any other advice that perhaps you would have for a public agency that's developing their own research strategy?
I think the most important advice is to understand the needs of who's going to be using the research. At ISCRR, we want to understand better all the time about who the injured worker is, what that lived experience is, what value that could provide to the research. And we're very fortunate that WorkSafe Victoria is on the same page in terms of how they conduct their research. So rather than it be the researchers dictating this is what needs to be done, and then those who are funding the research saying, oh, this is what aligns to our strategy, therefore we're just doing it. It's looking at what are the real pressing needs and what's the best way to approach that. And I think that's imperative for any type of research framework that's set up.
Thanks, Jimmy. The next question, you talked about the needs of your partners, and indeed ISCRR has developed a research impact measuring framework adapted to the needs of our core research partner at the moment, WorkSafe. And linking to that, you pointed out that impacts might only occur years later. So how, do you propose or have any periodic assessment of past projects to capture those late impacts? And how do you use ISCRR's research impact framework to incorporate that measurement?
Yeah, so through our initial pilot studies, we found that just setting a timestamp, whether it be 6 months or 12 months to then assess impact, doesn't work, because it really depends on each individual project when the impacts are likely to occur. What we're hoping that through this continual analysis is that we'll get a better idea of when impacts are likely to occur based on the type of research that occurs. But it's really, again, having that continual dialogue with the research users to then determine what the impacts are intended to be, when they're likely to occur, and also when it's feasible for those measures to be taken.
Thank you, Jimmy. The next question also comes from the Q&A function from Max, and that is, how do you deal with your research impact assessment if a project has achieved multiple impacts? For example, if there's been changed policies in several states as opposed to only one. In the current way that research impact is measured, it sort of each measures or levels appear as equal achievers in your summary stats. Can you comment on that, please?
Yeah, so at the moment, we gave a very high level in terms of categorizing based on three levels, purely based on the number of projects that are involved. Our ongoing analysis now that we're increasing that analysis so that denominator is getting larger, and we have identified that, yes, most definitely, particularly within the decision-making level, there are different levels and categories which may have, we may be able to rank in terms of that level of impact. And indeed, within individual projects, we have found also, and this is something that we just need a bit more numbers to verify, is that those projects with more outputs tend to be more likely to achieve impact quicker. And so what we'll look at is most definitely, as suggested, is that which of our outputs have led to it, but then also to then put a bit more of a quantitative metric about that, the number as well, because yeah, we have found that some projects have given a flurry of impact measures coming through, and others has been quite scant in comparison. And that's also very much linked and related to that engagement, so that champion. So that quality of data does influence and bias those findings quite a lot as well. So we have to make sure that it may be that it's that communication level with those individuals or group or team who provide the data might be more giving that a biased view of that impact, as opposed to a project that may have multiple impacts, but we're just not able to capture them.
Thank you, Jimmy. I hope that answers your question, Max. Next question comes from Coralie Nash from WorkSafe. Hi, Coralie. So what factors determine whether ISCRR would directly support any research activity or outsource this to other external groups? And do those external groups operate under the same research impact framework?
Well, yeah, I think that you could help address this question as well, Kim, because you're quite involved in this process at ISCRR. In terms of, and I'll start from the end of that question, that in terms of the priorities given, so for our preliminary analysis of what I provide today was looking purely at ISCRR-led research. We endeavour that all research that is passed through ISCRR, we give the same level of attention to and merit to for impact assessment, because we find it's important both to show that value of that research investment, but also we want to find out where the research has led to. And there is that also academic fascination about, and to try and see that, has the research led to good? Has it led to positive change? And within WorkSafe themselves, they do have different systems of how they prioritize their research, and also whether research goes to us or to external providers. Kim, do you want to provide a bit of comment on that?
Absolutely. And I think to answer the second part of that question, it really depends on the needs of our research partner. So if the need and the end impact goals really speaks to involvement of ISCRR or previous ISCRR work that we've led, and sort of a cross-pollination of measuring impact, then we would certainly seek to have work with our external groups to operate under the same framework for ISCRR research impact. And I think that also I think answers the second question from the anonymous attendee about important to have those conversations early about what those end research impact goals for our research partners are, so that we can effectively capture those impacts, whether or not it's ISCRR-led, whether or not it's with an external group that might be in collaboration with a research partner that ISCRR is involved with. I hope that answers that. All right. Next question. Do you think thinking about research impact at the beginning of research? Oh, we've answered that question. Apologies. Let's move on. Another one from Max. How does the ISCRR impact framework relate to the research impact framework of Monash University? presumably they have one.
Yes, they do have one, and they do match quite closely. And so Monash have been great in terms of what they've been putting together as their 2030 impact strategy that you can find on their website. And where there were institutes and entities such as ISCRR that's part of Monash, we were invited to give our voice in terms of how do our individual approaches match that of Monash. And Monash, and indeed most impact frameworks, are conceptually very similar. Sometimes there might be a slight different change in the how the terminology is, but very much that the Monash system marries quite well to what we're doing. We just look at things from a very translational research space. The Monash model looks at also the importance of purely academic research and basic research and how that can then lead to impact change as well.
Thank you. And I just realized that the question that I had from the anonymous attendee hadn't been completely answered. So Jimmy, I'll ask that question for the floor again. Do you think measuring impact at the beginning of the research project affects the actual research itself, for better or for worse?
I say yes, it does. To bring impact into the conversation early and to plan for those measures to be taken does give that context to how the research will be taken. And I think that that does affect the research in a positive manner, because the danger of a lot of research is scope creep, that things that the research will take a bit of a life of its own, go on a journey based on what's being found, which is great for looking at creating new knowledge in that space, but then doesn't address that research problem. And so ISCRR's research that is very much based around that research problem, that in what we're talking about for WorkSafe poses, ensures that we're answering that and addressing those impacts. Now, during the project lifecycle, as new findings come about, new impact goals may be created. So it could be through conversations that we have with key groups, through the evidence that's found through the literature, that we're finding that, oh, perhaps that it's not only that the null hypothesis is rejected, perhaps there's a new way of thinking that comes through. And that gives new opportunities for new translational activities to new impacts, and that's able to be captured as it's occurring.
Thank you, Jimmy. Oh, wow. Lots of questions today, lots of engagement. That's really exciting. And we've unfortunately ran out of time. So for all of you that have posted a question in the chat but haven't had your question answered yet, please do feel free to reach out to ISCRR offline at info@iscrr.com.au. As I mentioned, a recording will be available to all registrants to view on ISCRR's website in the coming week. Now, Jimmy mentioned continuous improvements and measuring impacts, and ISCRR really values all of your feedback. An evaluation will pop up, box will appear shortly, so please do share your feedback. And also, if you are interested in attending any future sessions, we will continue to run webinars like this on a range of topics throughout the year. And if you have a topic of interest that you would like ISCRR to cover, please do contact us again at info@iscrr.com.au. Thank you again, everybody, for joining us. And now this webinar is closed. Thank you, Jimmy.